afternoon, everyone. I'm Gráinne Healy, Chair of the Sláintecare Citizen and Staff Engagement, and I'm delighted to welcome you to today's webinar, the 5th Sláintecare Integration Fund webinar, part of our Learning Network event series. As sometimes happens with these digital platforms, some of the videos we have for you today may move out of sync in places, so apologies in advance for that, but overall we're confident that it won't take away too much from your viewing and listening experience. We are taking questions during the broadcast, so if asking a question or making a comment, please do indicate who the question is for, and we will make sure to get the answers for you. The Q&A button is at the bottom of your screen, and if you type in a question, it will come straight here into me. We are very happy to be delivering these webinars in conjunction with the Health Service Executive and with the support of IFIC, the International Forum for Integrated Care. Sláintecare is, as you know, about providing right care in the right place and at the right time. And in these webinars, we'll hear how the projects funded by the Sláintecare Integration Funds and some HSE funded work is showing us best practice for healthcare reform and showing how many have adapted work practices and created improved pathways while responding to COVID-19. This afternoon, our focus is on health and well-being, empowering citizens, and we'll be sharing stories of projects and initiatives which focus on prevention and on empowering people and communities to get more engaged in our own health and well-being. The innovation and best practice that these projects represent will be of huge value to the work underway in every county to implement the Sláintecare vision, and as part of that, Healthy Ireland, the health and well-being promotion section. I am delighted to start this afternoon with a message of support from the Minister of State with responsibility for health and well-being, Mr. Frank Féin TD, who wanted to speak directly to you, our viewers and attendees, as we focus today on his portfolio, health and well-being.
Hello and welcome to the 5th Sláintecare Integration Fund Learning Network webinar. I want to record this short welcome and to personally thank you for your hard work and dedication to improving Ireland's health and social care services for the benefit of patients. The programme for government was very clear about the future of Ireland's health and social care services. We want to accelerate Sláintecare by bringing more health and social care services into the community and the home, making more services more affordable and fast-tracking our e-health programme. Sláintecare is about creating a health and social care services that meets the need of our population, attracts and retains the best healthcare professionals and offers the right care in the right place at the right time. It has a focus on promoting the health of our population to prevent illness, bringing the majority of care into the community and ensuring that we have the right capacity to meet the needs of our citizens. Healthy Ireland is a government-led initiative aimed at delivering the Sláintecare objective of preventing ill health and keeping people well. Healthy Ireland's goal is to improve the health and well-being of everyone living in Ireland. As Ireland continues to manage the COVID-19 pandemic, it is more important than ever that we maintain our individual and collective health and well-being. Sláintecare through Healthy Ireland is supporting these efforts by empowering people and communities to keep well. A healthier population doesn't need as much medical care either in the community or in a hospital. We have planned and are driving this strand of action via our National Physical Activity Plan, our National Obesity Policy and Action Plan and Tobacco-Free Ireland, amongst others. Each of these plans is focused on better population health and will mean reduced need for care. For example, by helping people get physically active, helping people prevent obesity and helping people quit smoking. The projects that the Integration Fund supports have innovation at their core, and I am delighted that you are all coming together to learn from one another and share best practices. Using the Integration Fund we have given 20 million in funding to 122 projects all over Ireland. These projects will help people stay healthy in their own homes and communities and have their care provided close to home when they need it. Many projects like the ones you will hear about today are focusing on empowering citizens to manage their own health, managing chronic diseases and helping patients avoid attending hospital. I've had the opportunity to see at first hand some of the Integration Fund projects. I took part in the launch of the Living Well project recently, and I also visited a Sláintecare funded social prescribing project in Waterford. I hope you enjoy hearing from the various contributors today. Each project showcased today and in previous Learning Network events demonstrate the fantastic work being done around the system and are a fascinating insight into how services have adapted while continuing to innovate during this time of crisis. The particular theme of today's webinar, Health and Wellbeing, is a fundamental element of how we are empowering people and communities to be more engaged in their own health and well-being. I would like to thank you all again for the work you are doing to deliver Sláintecare and to ensure the people of Ireland receive the right care in the right place at the right time. I wish you all the best with your projects over the coming months, and I look forward to hearing more about their impact. Thank you.
So thank you so much, Minister, for your support and for your message, and I think for your understanding of the work that's being done and that we're showcasing today. Before we begin our exploration of the various projects, I am delighted to bring in Dr. Tom Keane. Dr. Keane is chairman of the Sláintecare Implementation Advisory Council, and Tom was also the man many of you will know who headed up the development of Ireland's successful cancer strategy in recent times. I spoke with Tom earlier in the week as he joined me from Canada and asked him to outline his views on the importance of health and well-being for the successful delivery of Sláintecare.
No.
So I'm very pleased to be joined this afternoon by the chair of the Sláintecare Implementation Advisory Council, Dr. Tom Keane. Tom, you're very welcome to our webinar this afternoon.
Thank you. Happy to be here.
Great stuff. So as you know, this is the 5th webinar, Sláintecare webinar, and our theme for this afternoon's webinar is health and well-being and community empowerment. And I think they are core, strong themes for Sláintecare. Maybe you'd start off by talking as chair of the Sláintecare Implementation Advisory Council and tell us your views on how important health and well-being are to delivering the overall Sláintecare objectives.
Thank you, Grania. Well, you know, it's not just in Ireland, but in Canada and many other countries, the realization that keeping people healthy and well is actually a fundamental priority for healthcare policy. It's not flashy, and I think we all know that acute care and wait lists and trolleys, they get all the attention, but the leverage that keeping people healthy, making them live longer, healthier lives is huge. I mean, the impact of relatively small changes in how people live their lives, diet, exercise, healthy behaviors in terms of smoking, alcohol, many other things. And more latterly, I would say obesity has become a major health risk in Ireland. So this is a way, it is, in my view, probably got the greatest leverage for fundamentally altering the profile of Irish healthcare than any other initiative within Sláintecare. The problem is that prevention and promoting wellness is a message that is difficult to maintain. We all know about resolutions made in the new year about diet and everything else, but so it needs to be constantly reinforced. So it isn't expensive. I mean, it's largely a matter of communication. The scientific evidence that underpins leading a healthy lifestyle is totally available and is undisputed. I was reading a report today in Canada that they've estimated that 15 minutes of exercise every day could amount to an extension of life by 2 to 3 years, which is incredible when you think about it. So I see this as a cornerstone of Sláintecare, and it's something that I know the Healthy Ireland issue has been moving ahead for a number of years, but hopefully now that it's fully embraced within the Sláintecare agenda, we will begin to see its adoption. And you know, it is interesting. When I was last in Dublin in February before the COVID epidemic broke out, you know, it's amazing to see the number of people who walk to work, the number of people on bicycles. All of these things are good, tangible evidence that people are adopting healthy lifestyles in their daily lives.
Mm. And I suppose very much in line with what you're saying, you know, this is a fundamental part of the Sláintecare objective, but also, you know, we're seeing that the integration funded projects, which we've been showcasing over the webinars, many of them are giving this focus on prevention, and fundamental to that is empowering people and communities to just be more engaged in our own health and well-being. Would you agree that that's the correct approach?
Absolutely. You know, there's something very granular about the approach that is required in order to make lifestyle changes a permanent feature. And communities in Ireland have, I think even the recent experience with COVID has demonstrated the power of community engagement, the power and enthusiasm that can be generated through community-led organizations, whether it's the local GAA club or other organizations within the community. That is where I think things really happen. I mean, there is leadership required at a national level, but in terms of implementation, doing things in the community, being led by community leaders, by people who are known and recognized by the community, is at its core the most successful strategy. And that's not just in Ireland, I think is recognized the world over. The opportunity for community engagement, supported by technology, supported by, you know, I think relatively modest government funding. It's really about getting the message out and communication.
Absolutely, and we're certainly seeing that in many of the integrated fund projects that we've showcased and in the ones that we've chosen that we'll be sharing later on in the webinar today. Tom, thank you so much for taking the time out of a busy schedule and for joining us all the way from Canada. We really look forward to seeing you again in person at the Advisory Council meetings when we get over the other side of this. But for now, Dr. Tom Keane, thank you so much for joining us.
Thank you, Roddy. Bye-bye.
Great. Thank you, Dr. Keane, for your work on the Sláintecare Implementation Advisory Council, and I think for giving us a clear context for and supporting the prominence that we're placing on health and well-being in our webinar today. So a number of people already this afternoon have mentioned Healthy Ireland, and I am delighted now within the HSC to introduce Sarah McCormack. Sarah is the National Healthy Ireland lead, and she's going to help us understand the importance of Healthy Ireland work. So here is Sarah McCormack.
Hello, I am Sarah McCormack. I'm the National Lead for Healthy Ireland in the HSC. Over the next few minutes, I will share with you some of the work of our HSC Health and Wellbeing team. It is recognised nationally and internationally that healthcare systems must prioritise primary prevention, early intervention and improving health and wellbeing to reduce the growing levels of chronic disease. Chronic disease is largely preventable, and a change in our lifestyle behaviour can bring about an impact to our health and well-being. During COVID-19, we have seen more and more people take a greater interest in their own health and well-being. Improving the health and well-being of our population is a key principle of the Health Reform Programme. Sláintecare identifies the need to reorientate services from acute service provision to primary and social care. Our partnership with Healthy Ireland in the Department of Health and Sláintecare help us to deliver on the various health and wellbeing policy priority programmes, which include a focus on tobacco control, physical activity, healthy eating, positive mental health, sexual health, and reducing the harms of alcohol. HSE Health and Wellbeing have a number of public-facing campaigns. These include Quit. Our latest successful communications campaign, launched in January, encourages people to take the 28-day challenge and stay quit for 28 days. Tobacco is one of the risk factors that, if changed, can dramatically improve people's health. Smoking is a risk factor for acute respiratory infections like flu and COVID-19. Helping people to quit smoking increases their chances of avoiding the risk of serious infection and other complications that are linked to smoking. Our focus during COVID-19 has been on social media activity aimed to encourage people to avoid harmful patterns of drinking and highlight the more serious impacts on mental health. Our askaboutalcohol.ie website offers great tools and resources for people and for services, and has seen contacts increase by 70% in 2020. Recently, HSE Health and Wellbeing hosted a fetal alcohol spectrum disorders prevention webinar, which was part of a drive to encourage expectant mothers not to drink alcohol during pregnancy. On the healthy eating front, we have the START campaign, which is a partnership between Safe Food, HSE and Healthy Ireland. Our aim is to encourage and support parents to make changes in the family to support healthier lifestyle for all. The campaign focuses on providing parents with practical advice and resources to help with healthier meals and snacks, increasing playtime and physical activity, reducing screen time and improving sleep. Resources and supports are available on makeastart.ie. The My Options campaign promotes HSE unplanned pregnancy support services. My Options is a HSE free phone line that provides free and confidential information and counselling to people experiencing an unplanned pregnancy. My Options also provides a 24/7 nursing team for medical support and reassurance over the phone to people who are in the process of having or who have recently had an abortion. In 2019, there were over 13,000 calls to My Options and over 2,700 calls to the nursing helpline. We also provide funding to 11 services to deliver free and accessible face-to-face unplanned pregnancy and post-abortion counselling. For more information, you can visit myoptions.ie. Face-to-face training has been suspended during COVID-19, but we have successfully transitioned 2 of our mental health programmes, which are now delivered online. Stress Control is a 3-week programme viewed by over 12,000 participants, designed to help people cope with stress and strains of life. We will shortly launch Minding Your Wellbeing. This programme is designed to support people to take a positive approach to their mental well-being and focus on things such as self-care and how we can boost our resilience. In line with Sláintecare's new model of care, Health and Wellbeing is implementing Making Every Contact Count. This programme encourages and supports healthcare staff to undertake brief interventions with service users in order to support a positive behaviour change in the areas of smoking, alcohol consumption, physical activity and healthy eating. A range of resources are available, including an online training programme to support staff to start these conversations. Resource materials across all of the topics are available to help guide and support service users, and these include a Know Your Numbers card, which encourages people to familiarise themselves with their own numbers such as cholesterol and signpost them to further information. We also develop health and wellbeing programmes for preschools, primary and post-primary schools. We work with the Department of Education to deliver evidence-based training programmes for teachers. Last year, an alcohol and substance misuse programme called Know the Score was launched, and our mental wellbeing programme for young people, such as Mind Out for senior cycle post-primary or Zippy Friends for primary, have been running for many years. We have worked with the Department of Health on the development of a Healthy Campus Charter for higher education institutes, which is now in the final stages of development. This Healthy Campus Charter seeks to strengthen support for health and wellbeing in third-level institutes and colleges. Our network of funded partners deliver various health and wellbeing initiatives to priority targeted programs such as people with a disability, older adults, men and young people. We will continue to further support and develop health and wellbeing initiatives to improve the health and wellbeing of our population. Thank you for watching and for your continued support.
Thank you very much, Sarah, and we'll come back to you during our panel discussion with some questions on that presentation. But I think great to get that overview of exactly the kinds of public-facing campaigns that Healthy Ireland with the HSE and Sláintecare are rolling out at the moment. And so onto our projects. Our first video today showcases smoking cessation programs. Firstly, Smoke Free Start, which is an initiative between Tobacco Free Ireland programme and the National Women and Infant Health programme. This aims to develop capacity and capability in a maternity setting to better diagnose and treat smoking during pregnancy. We'll also hear from Kate Cassidy about her project called Supporting Pregnant Women to Quit and Stay Quit, run by the South East Community Healthcare. This project is helping everyone involved in the journey of the pregnant woman to stop smoking. The project has initiated and integrated smoking cessation services for pregnant women and their families. So here's Martina Blake, lead for Smoke Free Start, and Kate Cassidy of Supporting Pregnant Women to Quit and Stay Quit, to tell us about their work.
My name is Martina Blake. I'm the national lead for the HSE Tobacco Free Ireland programme, and I'm delighted to be here today to talk about our Sláintecare maternity projects, two projects which are being rolled out nationally and in CHO5, which are aiming to support pregnant women to quit and stay quit and improve our maternity care. So the background to the project, why are we interested in doing this? I suppose Healthy Ireland, the Tobacco Free Ireland government strategy and the maternity strategy all advocate for investment in cessation services in maternity care and improved outcomes for women and babies as a result. We know that smoking is the most common preventable cause of poor pregnancy outcomes, and it's associated with maternal, fetal and infant mortality and morbidity. Smoking can cause smaller babies, growth retardation, placental abruption, placenta previa, sudden infant death, miscarriage and obstetric complications. So investment in cessation prior to pregnancy, during pregnancy and subsequently is really important and improves outcomes for everybody. We've had very poor services prior to the implementation of the Sláintecare project. We only had one dedicated stop smoking service in one site, part-time, 1 day a week. So we're really delighted that we've got this investment and that we can see and demonstrate that these services improve outcomes for women and babies. So in summary, what we're aiming to achieve as part of this project is to deliver the right care in the right place at the right time with the right result.
So thank you, Martina, for that introduction to the project. And I want to welcome now Kate Cassidy. Kate, you're very welcome. And we're delighted to be hearing about this really, I think, really exciting project that's already having how many babies? How many Sláintecare smoke-free babies?
So we have 14 babies born smoke-free.
Wow, isn't that great?
Yeah, it's fabulous because the project started in February, and if they came in early in pregnancy, they're the births we're seeing now. Yeah. And it is just fabulous.
Great. And listen, tell me, it came in February, so COVID hit us all in March. What kind of changes did you have to make to how you were running the programme when COVID hit us all?
Well, so Grania, we were so delighted to get the Sláintecare funding and to establish, and we were just getting into the hospitals and speaking with midwives and the multidisciplinary team, great implementation group up and running when COVID hit. And I suppose now speaking retrospectively, because we've all adjusted somewhat to the new ways of dealing with COVID, but back then there was a certain amount of paralysis that happened to people when they were reflecting on how are we going to deliver services. And we were really mindful not to put an extra burden on a midwifery team by asking them to reorientate how they worked as well. So I suppose the most important thing we actually did at that time was step back a little bit and give everybody some breathing space to get their own practices up to COVID standard and risk assess. But we still kept the lines of communication opened. We still contacted them by email and reassured them that we wanted them to continue referring in the patients. And we took it from there.
Okay. You did go to virtual appointments though, didn't you?
We did go to virtual appointments, but because the carbon monoxide monitoring was so important on that booking in, we told her, we completely informed them what was going on. And if people choose to come, we did things like their assessment while they were in the car and had them in for less than 15 minutes for the intervention. Right. So a lot choose to have the one-to-one. And if they didn't, we went virtual, we did WhatsApp calls, we did attend anywhere. Whatever way they wanted to service.
Right.
There is a stigma attached to pregnant women smoking and they feel it. So by doing an opt-out carbon monoxide test, it gives the midwife the opportunity to engage with the woman and say, you know, your carbon monoxide should not be above 4 parts per million if you're not smoking. So it gives them an opportunity to do their 3 A's, ask, are you a smoker? Advise, best thing you can do for you and your baby is quit. We have a good service here. Women are finding it useful. I'll arrange an appointment for you. That's our 3 A's and our, you know, and women don't refuse, you know, so when we delivering training with the midwives, so making every contact count was a big part of the planned delivery of training with midwives. We did get an opportunity to continue that. You know, the question always came up, and rightly so, what if they refuse?
Yes.
Pregnant women don't refuse service, Grania. Like, our whole project was based on non-scare techniques, no stigma attached, a compassionate service delivered in a non-judgmental way, in adherence to what Sláintecare would ask.
Exactly.
And in our leaflet, we never did one write-up about the scare tactics of being pregnant and smoking.
Yeah. Yeah, and the other thing I liked about your approach is, so you have the from the community into the wives in the hospitals, and then the other way out as well, from the midwives out into the community. Yeah. So you have great flexibility in the models.
Absolutely, it's exactly what Sláintecare asks. It's an integrated, you start in the community. We started with the pharmacists. If we gave them all our leaflets, I did an information session with them, that if a lady comes in looking for folic acid, you give her a leaflet about our service. We spoke to all the pharmacists about, you know, to deliver the 3 A's. They're very good at brief interventions. Then we worked with the community, family resource centres, social inclusion people around Travellers Healthcare, Roma community. And then once the lady got into hospital, she was getting the consistent message. And now we're at the lovely part of the project where the babies are being born. We want them maintained in a smoke-free environment at home. So we're including granny and anybody else and partners. And now we're working with the public health nurses to make sure and reinforce that message to the woman, because relapse is a big part of this, Grania, when the baby is born.
Of course. Yeah, and I noticed that the 4-week quit rate is 85%. That's a fantastic result.
It is Grania, we could not have imagined this. We couldn't. I mean, the 4-week quit rates are expected to be someplace between 40 and 50% nationally in the NHS in Ireland. We are achieving over 80% consistently, and most of those are carbon monoxide validated, which is a real good marker. It's because we're doing what it says on the package you need to do. You need to deliver a non-judgmental, compassionate service where the person knows that they're the centre of the intervention. It's about them. We're not judging. We're not thinking any worse of somebody who struggles through it. We're delighted.
Yeah, great stuff. So we're going to finish this interview. We're actually going to play a little clip of one of your mothers, and I think she speaks for the success of the work you've been doing. Well done to yourself and Martina. Thank you so much.
And there's a big team behind Grania, and I want to thank all of them as well. Thank you.
Well done. Thank you.
Thank you.
Hi, Laura here from the South East Community Healthcare with the lovely Sláintecare smoke-free baby, David. Thanks, David, for all your help, and I'd highly recommend it. People going to you, and I'm delighted to be smoke-free. Thank you.
So, baby David, how gorgeous is that? Kate is going to come on just to have a little conversation with me. Kate Cassidy, we were listening to the results that you're having, and we were admiring the work that you've been doing. Kate, your results are great. Can you tell me what you think are the 2 key strengths of the project and the approach you've been taking? 2 key things that you've been doing right.
Okay, well, Grania, first of all, getting the right team together to get this project up and running, to go wide and search for and have your backroom team, people who will support you implement this. So the SECH community are there behind us all the way.
Yeah.
And secondly, we are evaluating the project as we go along, which your voice matters. It's a patient narrative programme. And what we're hearing back about that from the women that are sending back in their evaluation is they love the fact that they're getting a service that's compassionate. They don't feel judged, they feel safe, and they leave the one-to-one intervention feeling heard and feeling proud of themselves.
Super.
So that's what's working for us.
Right,
Thank you.
That's the secret. Okay, Kate, hopefully we'll come back to you later on in the panel discussion, but well done and thank you for that presentation. Really, really interesting, successful work. Thank you. Our next video is from Living Well, which the Minister referenced in his message. Actually, there are 6 initiatives involved in Living Well, all involved in offering support to people living with long-term health conditions, including asthma, COPD, diabetes, heart disease, stroke, and arthritis, among other conditions. And it's also for carers of somebody with one or a number of these long-term health conditions. Here to tell us about Living Well is Maeve McKeown, Self-Management Support Coordinator in the CHO Area 1.
Hi everyone, my name is Maeve McKeown. I'm a Self-Management Support Coordinator in CHO Area 1. I'm talking today about the 6th Sláintecare funded Living Well projects. Living Well is a group programme for adults with long-term health conditions. The programme supports participants to develop the self-management skills needed to realise better health outcomes and quality of life. The focus of the programme is about developing a toolbox of key self-management skills as depicted here. It's a structured peer-led programme. At least one of the 2 trained facilitators are themselves living with a long-term health condition. The generic name for the programme is the Chronic Disease Self-Management Programme, the CDSMP. It is a Stanford University programme developed in 1995 and delivered worldwide. For more information, you can visit hse.ie/livingwell. In Ireland, since 2005, this programme has run under various names, branding and governance, delivered by a small number of partners within the HSE and the voluntary sector. However, the CDSMP landscape in Ireland without formal cohesion between providers is confusing for service users. The Sláintecare Integration Fund represented an opportunity to pilot a unified, streamlined approach to delivering the CDSMP in Ireland. 6 CHO health and wellbeing areas secured Sláintecare funding to deliver the programme in 2020. Project leads are the 6 self-management support coordinators in these areas, CHOs 1, 2, 5, 6, 8 and 9. So the original plan for the projects was regionally for project leads to develop or expand the programme in their respective CHO areas, to build a regional project team, deliver Living Well within the CHO to adults with long-term health conditions as originally designed, i.e. as a classroom-based programme as depicted here. All 6 projects collaborated to develop standard operating procedures, devise a communications strategy where GPs and primary care clinicians are identified as key stakeholders, design a research project collaboratively. This research will evaluate in the Irish healthcare setting participant outcomes and implementation processes in order to demonstrate scalability. The anticipated outcomes for participants on the programme were and continue to be enhanced self-efficacy, improved exercise behaviours, enhanced quality of life and high satisfaction with the programme, using the means of verifications outlined here. With the onset of COVID-related restrictions, the Living Well teams worked together to adapt the delivery model to online, adapting the programme structure to fit the online model, amending the content to align with current COVID public health recommendations, and revising the operating procedures. This transformation was done over a 3-week period by the Living Well team members in CHOs 1 and 2, who up to that point were novices in the world of online platforms. Amending the resource table to ensure COVID resources are signposted. Now this is normally a table of hard copy leaflets and it's now a listing of online and electronic links. Changing the facilitator training model to online and changing the research project plan to capture participants and facilitators' experience of doing the online programme. Some of the challenges we have faced: sourcing an online delivery platform for a group programme which enabled a positive peer interactive experience and which was workable for all 6 project areas was a challenge. Each CHO area has different challenges relating to digital connectivity, such as broadband quality and health IRL domain status. So a universal solution has not been established. Rather, each area is delivering the programme via whichever platform works for them and in compliance with Chief Information Office requirements. Participant recruitment was a challenge. While the new model removed the transport barrier, it has presented new barriers around digital poverty, such as listed here. These are universal challenges, not unique to Living Well. Some solutions we have introduced include addition of an introductory tech session, one-to-one support for participants where required, and ensuring a tech support person is in attendance at each session. Recruiting facilitators again is challenging at the best of times, but the additional digital requirements has significantly reduced the pool of available facilitators and increased the work of facilitator recruitment. The online model is more resource intensive due to these and other factors, and also due to the reduced participant capacity of the online programme. This has impacted on project outputs for the projects. Adapting the research methodology involved trying to interface 2 online survey instruments. This was not resolved and is entailing increased data gathering inputs at regional project level. Recruitment processes have been a challenge at all stages, and the COVID-related recruitment pause and redeployments placed a larger burden on project staff during a highly industrious change period. Unexpected benefits. So it's important to view any of these benefits or disbenefits with the awareness that this is still early days in the transition to online. So any observations are preliminary and will be monitored through the evaluation process. In the main, participants who were engaged to do the online programme are very happy and enthusiastic about it. Participants and facilitators have commented on the convenience offered by the online model, and here's one such typical comment: the course was ideal for me being online as I could do it from the comfort of my own home, and so on. Other unexpected benefits preliminarily observed include a trend towards improved attendance rates, improving equity of access. Notwithstanding the barriers to digital health delivery outlined earlier, being online helps overcome the perennial access barriers of geographical spread, transport, physical impairment and ill health, as well as the more recent COVID-related barriers. For example, in CHO1, Each online programme has had a mix of rural, urban and in a few cases island dwelling participants. Moreover, going online has enabled the programme to be available to people in any part of Ireland. This is demonstrating more strongly the feasibility of scaling the programme to all of Ireland. And for the first time, we've had people participate from their hospital ward. Reduced demands on peer facilitators related to travel, etc. Increased confidence and sense of achievement for participants and indeed facilitators and the entire project team relating to digital skills. So to finish with, we can listen to the participant voice, and I'll introduce you to Martin, who is a participant, and Mary, who is a peer facilitator.
I am currently living with heart failure and cancer recovery. I was delighted when I found out that I could access the online Living Well programme for a 6-week course, and that gave me the confidence to be able to deal with my issues in a safe way.
I have type 2 diabetes and arthritis, so I understand the challenges involved in living with a long-term health condition. As a facilitator on the Living Well programme, I find it very rewarding to see participants grow in confidence as they develop a sense of control over their health condition and their lives.
Great, and congratulations to Maeve and the team on the adaptation during COVID. I think it's always wonderful to hear the stories of how complex programs have actually adapted in really innovative, creative ways. Maeve, I want to come to you. You said that going online has increased the uptake. Do you know how many people have availed of the Living Well programme so far? And also a question about how do you enroll participants to the programme?
Hi, Grania. Yeah, so early indications are indeed that going online has enabled increased uptake of Living Well by more traditionally hard to reach cohorts, such as younger adults with long-term conditions or those with mobility or transport challenges. However, because of the capacity of the online programme, as we indicated, is reduced from a maximum of 18 for the face-to-face version to 12 for the online version, and also because of the challenges with recruiting online participants, relating to digital literacy issues, as we outlined. Overall participant numbers for the online programme are expected to be less than for the face-to-face version. Notwithstanding that, to date there have been 357 participants engaged across the 6 projects at sort of the midway point really in terms of our delivery. As well, to relate to the enrolment pathways, access to the programme is via self-referral, but clinicians and other stakeholders such as community and voluntary agencies are encouraged to signpost adults with long-term health conditions to the programme. So a key enabler in streamlining this access process has been the development of a Living Well webpage, and that was developed by all the project leads together working with HSE Communications. And in line with this, we've engaged HSE Live as a centralised point of contact for those with queries or wishing to register.
Great, thanks very much for that, Maeve. We'll come back to you in the panel for further questions, hopefully later on in the webinar. Thanks very much for sharing that with us. Our third project video showcase this afternoon is from educator Nick Fenlon of the Irish College of General Practitioners Patient Self-Management of Chronic Disease project seeks to develop and deliver an evidence-based education package to GPs and practice nurses on patient self-management of chronic disease. It is known that GPs trained to help patients change their lifestyle makes a difference. I spoke with Nick earlier in the week about their project and its progress.
And welcome to Nick Fenlon. We're delighted, Nick, that you've been able to join us. You've been involved in a Sláintecare funded project, provision of education on self-management of chronic illness to GPs. Nick, talk a little bit about the problem that you're trying to solve with your project.
Thanks, Grania. Thanks for the opportunity. The problem we're trying to solve is sometimes the responsibility for a chronic disease management is left with the GP or left with the doctor or the medical practitioner. And I suppose our project is about putting the emphasis back on patient care and patient-centered medicine and giving responsibility and empowerment to the patient for their role and responsibility in the management of their own chronic illness. So our project is about educating GPs that will in turn empower patients to self-manage and self-care for themselves with a chronic condition.
And how are you doing that?
We're doing it in a number of ways, because I suppose lots of GPs learn in different ways, and they're very busy people. So we set out originally to deliver a number of regional-based workshops where we would meet with groups of GPs and put them through the skills and the tools and developments on how they can communicate well with patients on patient care empowerment and behaviour modification. As well as the regional meetings, we had planned to deliver a number of webinars whereby people could log in without having to attend a meeting for the same material. And our third element was to look at an e-learning module that was pre-recorded that people could work through. And I suppose to take a measurement was to look at what GPs were doing before they engage with the education. So there's going to be a pre-survey. Following the education, how their behaviour has changed, how their interaction with the patient has changed, and that was going to be part of our post-research survey.
Okay, and then COVID happened.
And then
COVID happened. You have to change things.
We did. I mean, firstly, the whole focus, the focus, and we had been doing a lot of focusing, I suppose, on chronic care management, but now the focus was on responsive to the need during a pandemic. It threw us completely because everything dropped because we had to be responsive. Nobody knew where this pandemic was going. We had to focus our education on PPE and on safety and on patients and on doctors' care as well. So the focus from our whole education shifted in a big way. And I suppose how we deliver education changed, because like the regional meetings, for example, were just off the cards, from day one. We just couldn't get out into the country to deliver education. Yeah.
And yet you have managed to deliver. So what methods and means have you managed to overcome the COVID barriers? Yeah,
we've been fortunate in some ways in that with modern technology, I think we all had to come up to speed very fast. So GPs very fast, we had to get notifications, updates out to GPs very quick. So as an immediate response, we set up with Zoom webinars on a Wednesday night, and we've been delivering these webinars every Wednesday night since the outbreak of the pandemic. Most of them have been, this is the latest, this is what's happening, this is the advice you need to give your patients, this is even demonstrations on how to wash your hands, demonstrations on how to wear a mask, discussions on PPE. So we started to deliver weekly webinars, which was a new venture for us on a Wednesday night, because it's a time at the end of the day's work, but still interferes with family, and the response has been very good.
Right. So in terms of the sorts of outcomes that you were expecting when you made the original project application plan, have those changed? Are you reaching them? Have you had to alter them?
I think in some of them, we've exceeded the outcomes. So we would have hoped that an outcome of delivering regional meetings would be maybe we would hit 600 GPs in 6 different areas of the country. With the webinars, we were hoping that we would maybe have 100 people would log on to a webinar and engage in it. Now, on a Wednesday night, the numbers have just exceeded that. We will have between 12 and 1,600 GPs on every single Wednesday night.
Wow.
So in one Wednesday night, we have exceeded like what we would have, I wish would have been 600. We've doubled that and more. And rather than a one-off meeting, we are now introducing elements of our project into a number of our meetings. So when we have a meeting on cardiovascular care, we will always incorporate a section of that meeting about empowering the patient for self-care. When we have a meeting on chronic disease, we similarly integrate the whole project into a number of webinars. So our numbers have gone through the roof. We're delivering to far bigger numbers. Yeah.
Excellent. And tell me, I suppose the 2 key beneficiaries, so GPs and, upskilling them and changing behaviours, but also then patients, people with chronic conditions, managing them. Yeah. How are you measuring the impact on the patients in the first instance? Yeah, it's a difficult one. What we're measuring is, we're looking at the measure of the impact on the patient, but firstly we're looking at the measurement of the impact of our education on the GP. Okay. So we've designed a survey that will ask to GPs about their
before all this education, what their behavior, how often they would ask a patient about self-management, what behavior modification advice they would give, and we take that measure. Then we engage with the education, which is like our intervention, for the want of a better word. And then we have a post-education survey looking at how has your behavior changed? How has your interaction with the patient changed? How more focused are you now on behavior modification advice and empowerment to the patient? And that's what our measure. It's much more difficult to measure, did this impact on the patient? The research that we've covered out, we've carried out a systematic review as part of this that shows education by GPs to patients does impact and does empower them. Measuring that, because if people change behavior, what was it that changed it? Maybe the GP advice was part of it, but it's very hard to take full credit. It could have been, it's Lent, or it's, you know, it's a lockdown, so it's time for me to look after my own weight or measurement. So that one is a little bit harder to measure.
Okay. And briefly then, you know, as a Sláintecare funded project, how are you delivering right care, right place, right time, in your view?
I think that we're very responsive. So our education is very much of what's happening at the moment. And I think, for example, we're not making presumptions. We're looking at the real consultation. So, for example, one GP would have said to me, well, a few months ago, I would have sat down with the patient and I would have said, right, now this is the plan. And I would eyeball them and I would shake hands with them, say, right, we're entering now an agreement.
Contract, a
contract. And that was part of the empowering of the patient. Now it's on a telephone. And I'm trying to say to them, you know, we're still entering a contract, but when you can't eyeball them and when you can't say, and I want you to come in now every couple of weeks so we can see where we're at, you know, it's much more difficult for GPs now because it's a lot of telephone consultations and it's a lot of responsive consultations to a very anxious group. Whereas I think it was almost a luxury to be able to say, okay, you've got a chronic disease, you've got diabetes, but we're going to work through this long term. Whereas now GPs consultations are very responsive to an immediate need, which has to take priority, you know.
Right. Okay, Nick, thank you so much for giving us your time this afternoon. Best of luck with the rest of the delivery of the project, and we'll talk with you a little bit later on in the programme.
Thank you very much. And again, thanks to Sláintecare, because it helped us to as well as funding and that support, it helped us to focus on the importance of this area, because we get so many demands for education right across the spectrum for general practice that I think sometimes this type of area can be neglected. So with Sláintecare and the focus of Sláintecare is really appreciated by the Irish College of General Practitioners and GPs in general. So thank you.
Great, thank you very much.
Great. Thanks for that, Nick, and you're welcome here with us this afternoon. Nick, you've told us about how you are reaching, my goodness, 600 was the aim, and you're having between 1,200 and 1,600. There's some figures. I suppose, though, the question I would have for you is, you know, what is required to maximize the benefits of the approach that you're currently taking? What do you think you need to sustain this?
Yeah, I think, thanks, Grania. And I think to sustain it, I mean, the whole slogan, right care, right place, right time, is kind of appropriate now for education to GPs. It's right education, right place, right time. Our education, what we've learned is that our education needs to be responsive, needs to be so relevant and on the ball, because GPs, I've never seen GPs under so much pressure from multiple sources. And so many, I suppose, organizations and patient groups, and everybody feels, okay, my area is the most important for the GP. Turn on the radio and it'll always say, consult your GP, ask your GP, go to a gym. Before you exercise, consult your GP. So there's a huge demand. So it's incumbent on us to deliver responsive, relevant, up-to-date education. So it's the right education in the right place. And at the moment, I'm fascinated that after such a busy day, I mean, GPs are starting at all sorts of hours now, responsive to all sorts of needs, and yet they will log on for an hour to an hour and a half on a Wednesday night. We're still maintaining between 12, 14, 16, 1800 GPs per Wednesday night. And I mean, what they're doing is sacrificing their family time. that's the time they should be with their family and children. So it has to be, I mean, the right place. They are saving and they don't have to travel. They don't have the expense of travel or the time to travel. So they can be in their own home, and within an hour and a half, they can be finished and back with the family.
Yeah, great.
And the right time then is evenings on a Wednesday. It seems to work for GPs, and we have to really calculate that very carefully.
Okay. Listen, thanks again, Nick. We'll talk with you later in the webinar. Hopefully, keep up the good work. Thanks so much.
Gráinne. Appreciate it.
So, keeping our focus on ways to support better self-management of chronic conditions, our next project, Health Air, represents a journey to improving health and well-being through community-based social self-care, using the Making Every Contact Count process, which has been referred to by a number of people already this afternoon. To deliver this programme, I spoke with Dr. Michelle Flood, Senior Lecturer with Royal College of Surgeons, Ireland, and I asked Michelle to tell us about how this community-based initiative is going.
You're very welcome, Michelle Flood, from a programme with an interesting sounding title, Health Air. Tell us a little bit about the project.
Sure, and thanks for the opportunity to share the project today. So I suppose put most simply, our project is about making brief interventions happen. So as the majority of, I suppose, the people watching will know, brief interventions have a significant evidence base and are supported with strong policy from the HSE through the Making Every Contact Count initiative. But what we do know is they're still not happening in practice. So what we wanted to do was try and understand the barriers arising in practice and find an innovative way to address those, to support, in our case, GPs and pharmacists in the first instance, to deliver these brief interventions in practice. So it's actually quite a complex problem because it's a system level problem. So how do these things fit with existing services? So we assembled an interdisciplinary team of healthcare professionals, a health psychologist, organizational psychologist, biostatistician, and also really importantly, designers to help us design a good solution to this really complex problem. So we started with patients and the people who'll be using it, and did user research, understood their barriers, as well as going to the literature to understand, what's already known about this topic as well. So we were delighted that patients really felt this was something that they wanted, that they felt that actually, in their GP or when they're in with their GP or their pharmacist, they're happy to talk about this, because sometimes as healthcare professionals and pharmacists, you feel bringing it up might somehow maybe harm your relationship or make somebody feel like they're nagging. So we decided that we'd be able to leverage waiting time within a consultation, so waiting to see your GP or waiting for your prescription, to blend technology with personal interaction then. So that time that would normally be wasted waiting is now repurposed into a model that's aligned with the 5 A's approach that the MEC program promotes. So when the patient or the person is waiting, they use the Health Air tool to complete the ask, assess and advise steps of the brief intervention. So that's done through the digital interface, and that frees up time at the
So this is like an iPad or tablet
so
of some kind?
It's on a tablet, exactly. So
okay.
We wanted to use a tablet because it's very flexible. So people are in a consultation room, or now during COVID, if they want to go out to their car to do it, they can do those, I suppose, those standard screeners that we always ask people to do. So that saves up time, and the patient can select the topic they'd like to work on from the MEC choices available. And then the healthcare professional links the patient with local services available. So there's a directory built into the tablet that allows people to get the advice they need to go to something.
So what kind of questions are you asking on the tablet?
Yeah, so the tablet, so we were very much trying to align with the HSE's goal around MEC and implementing it. So it's a standard assessment tool. So things like the Fagerstrom test using DoDit. So the evidence-based tools that we have that we use to do these things in practice. Now we had to modify one, so the BMI calculation wasn't quite workable given all the situations at the moment. So we consulted with some colleagues and are using a slightly different model for that to start a conversation around weight management. So yeah, just the standard tools as well. So the patient can then come back and review their progress again whenever they're in for their next prescription or to see their doctor again. So yeah, that's how it works.
So So the principle of making every contact count is really about, I'm going in to get my prescription. While I'm standing waiting, I fill out this, and perhaps on that I might indicate, yeah, I'm a bit worried about my weight, or I'd love to get more exercise. And it is that response then that I get from the pharmacist or from the GP, where they say, well, Gráinne, you know, there's a walking group that starts on a Tuesday. So it's that very quick, responsive reaction that you're looking to promote.
Exactly. And I think the other benefit is our system actually prints out a hard copy ticket. So you will get the details, the phone number, the website. You don't have to go away and look that up yourself. So it's literally in your pocket for when you go home to make the call or to check the website. So I suppose what we really want to do was embed the brief intervention in the consultation, because your responses are in with your GP or pharmacist before you have the consultation in a nice little visual summary, so they know what your priority is, and you know you've already done the work of providing the answers as well. So yeah, that's the premise behind it.
Super. And in terms of the evidence you have around these kinds of what you call brief interventions, is it strong evidence? Does it really make a difference?
Absolutely. So brief interventions have been shown time and time again to improve longer term outcomes. Now, I think, you know, we need to be realistic. It's not that every single intervention is going to lead to behaviour change. It's that, you know, 1 in 100 that make that change. That person, particularly around things like drugs and alcohol, there's huge evidence to show that it saves not only, you know, the patient a lot of, you know, unpleasant kind of health situations, but also saves the I suppose the healthcare system time and money. But more importantly, it stops the patient from, you know, being quite sick down the line. Yes. So there's lots of information for that. So our part, we're not trying to show that brief interventions work. We know that, and that's why it's a core policy. Yeah. We're just trying to make them happen.
Okay, great. So in terms of this project fitting in so well with the Sláintecare, right place, right time, just maybe summarise that. In what way does this fit so snugly into the Sláintecare objectives?
Yeah, so I suppose we were delighted when we saw the call, because we feel, you know, making evidence-based health interventions available within existing infrastructure, so easily accessible community-based healthcare facilities to anyone and everyone, the 20 million people that will, you know, make those visits every year, while saving their time in a really efficient way is a great way to make every contact count. So we really felt that it sat really nicely within the Sláintecare goals. And plus the fact it's open to everybody. So we've been delighted to, you know, learn from the social prescribing interventions and link workers, but where they're deployed is in the areas of highest need. So this is almost like a virtual social prescribing link worker equivalent that can be deployed within existing infrastructures, saving those, you know, core, you know, fantastic services for the areas that need the most. So, you know, and we've been delighted to link in with those other projects as we've gone through this process as well.
Right. And finally, maybe, Michelle, how are you going to measure the success of the initiative of Health Air?
So it's a really great question, and it kind of goes back to, you know, we're looking to make the, I suppose, the evidence-based interventions and the enabling policy happen. So we're looking to achieve just over 6,000 consultations within the time that we have available. And then we'll be able to model back from that, you know, the savings of different things. But I suppose more importantly, what we want to do is develop a new model that's sustainable, that's very scalable. We chose GP and pharmacists, but we've had interest from physios and other community providers as well who would like to get involved and engaged. We've a robust training model developed as well that'll be both digital and print. And I suppose that's really, you know, when we see brief interventions happening, and we have enabled people to do that within their existing workflows and within their existing practices, not something that's tacked on the end. But if we can say the barriers are lower, it's happening more often, that'll be our success.
Great. Super. Look, sounds like you're doing great work, and I love the idea of next time I go into the pharmacy, I won't be just standing there wasting my time. I'll actually be engaging in more self-care and self-management with a professional. Thank you so much.
Thanks.
Have a good day. Thank you. Bye-bye.
Great. So thank you to Michelle, and hello there. Nice to see you again, Michelle. Michelle, you're hoping to achieve 6,000 consultations as part of the project. How many have you achieved to date? And in how many sites or locations have you actually rolled this out so far?
Thanks, Grania. And again, thanks to Sláintecare for giving us the opportunity to run this project and also to talk today. So we're excited to find out how many consultations we have. So we have a monthly reporting system which will happen for the first time in October. So I can tell you in about, I suppose, 8 days time at this stage, but informally, I suppose I have to mention the two amazing staff on the project, Dr. Fabian Sweeney and Aoife Ludlow, are providing day-to-day support to all the 7 sites we have so far. So our goal was to have 7 pharmacies and 3 GPs. And obviously, as Nick has very clearly outlined, the GPs are, of course, under lots of pressure. But I will also shamelessly ask any GP who is interested in participating if they could reach out to our team, and we would be delighted to kind of try and get working with some GP sites at the moment. We have all 7 pharmacies recruited and started, not just in Dublin, but also in Cork and in Meath. And we're just trying to finalise getting the GPs on board. It's a busy time for everybody. We are delighted with the feedback we're getting so far from the pharmacy sites. You know, obviously it's a brand. This is a greenfield project. Didn't exist before. It's very, very, I suppose, novel in its approach. But we're really happy with the feedback we've been getting so far from the pharmacies, and hoping to try to maybe, you know, identify some GP sites sooner rather than later, so we can understand more about how it would fit. Obviously, with the level 5 restrictions, you know, people are more concerned perhaps.
Right.
Yeah.
Okay, thanks, Michelle. We'll talk to you again when we get to the panel phase, but good to talk with you. So the last, but by no means least, of our showcase projects this afternoon come from LGBT Ireland and their LGBT Champions programme. Recent research during COVID is showing that many lesbian, gay, bisexual and transgender people in Ireland have suffered from enhanced isolation during COVID. The LGBT Champions programme is designed to increase the visibility and awareness of LGBT+ issues at all levels within the healthcare systems. In particular, it works to ensure that older LGBT+ people will encounter services in which they know they can be open and comfortable being who they are. The programme creates a pool of health and care workers and trains them to build relationships and create awareness and a welcome for LGBTI+ people in all health and care services. I spoke to James O'Hagan, the programme manager, and he introduced us to some of the trainees and their experiences of the Champions programme. But first, let's kick off with some older LGBTI+ people telling us why the programme is so needed.
As I'm growing older now, my biggest fear, I suppose, as a trans person needing assistance or some type of care, would be that they don't respect who I am, that I'll be known as the trans person down in bed 7 and not Patricia down in bed 7.
You can't legislate for kindness, but you can create an atmosphere of that sort of caring, understanding kindness. Sexuality and orientation and everything else is totally central to a human being.
It's the fear of judgment and the fear of rejection. So we're coming from a very, very vulnerable place. And that needs to be treated very tenderly and gentle and with a huge amount of compassion.
What a powerful promotional video you have there. I'm joined by James O'Hagan and Mary Roach, who are both from the LGBT Champions programme, one of our Sláintecare funded initiatives. And I suppose, first of all, listening to Tricia, Eddie and Eilish, they've really laid out what it is to be an older LGBT person in Ireland, and some of the issues maybe around health care and just recognition of people's identities. I'm going to come in a moment to Mary, who actually has been through your training programme. But James, maybe you'd start us off just talking a little bit about what was the problem that LGBT Ireland sought to solve with the work you're doing.
Yeah, absolutely. And I think you hit the nail on the head when you said identity, because that really is at the center of what we're talking about. It's about people's identity being respected and coming from that vulnerable place that Eilish mentioned. So this project, it aims to prepare health and social care workers to understand and to create an inclusive environment for those older people who come from an Ireland very different to the one that we experience today, an Ireland where you weren't guaranteed or couldn't be certain of acceptance and inclusion if you identified as a member of the LGBT community, and you brought that fear of rejection with you, and that might be, even in today's climate, preventing you from accessing the help and healthcare that you need because of that fear that if you reveal too much about yourself or make it known that you're part of the community, that you're going to be pushed away or you're going to receive poorer treatment. And I suppose our champions, what they're doing is they're coming out as LGBT inclusive so that the older person doesn't have to have that fear of revealing themselves and their identity to the person, and also know that their identity is going to be respected, because as we saw with the 3 people in that video, it is so important and integral. When you fought your entire life to be able to be who you are, you wanted to be respected and you wanted it to be seen and celebrated, and I think that's what this project does.
Very good. And I know myself, the idea of, you know, people talk about coming out as if it's something you do once when you tell your mammy.
Yeah.
Actually, every time you go to a GP or a doctor or a dentist, or you're coming out every single time. So, Mary, you are an integrated care manager for older persons in Dublin, South Kildare and West Wicklow. Mary, you've been through the Champions training. Tell me, why did you want to go on the training, and what impact has it had on your understanding of the care that you provide?
Okay, so I would deal with a lot of vulnerable people in the community, and they would live alone and they not always engage with the services. And the Service of Integrated Care in Kildare is about trying to find gaps in the service and understand how can we meet the demands of different people. And it was just through discussions with local groups that it was kind of like, you know, they were pointing out that the LGBT older persons, you know, what services are out there. And it hadn't even occurred to me of older persons being LGBT, like a lot of the population. So I thought I wouldn't mind doing a course on this and getting some information. It doesn't matter how much information, it was just something so that I could just get an understanding. So I did the Champions course. And when you mention, you know, when I talk about what I do, one of the things I say is I'm an LGBT champion for older persons, and it's possibly the first time anybody's ever heard of that, and they are stunned, maybe a little bit embarrassed to say they didn't know, like us all. But you just explain. It's very simple. You don't need to know too much about it. It's just understanding it, and then layers and layers and layers. You get information, and you start to identify that it's just like any other group of people that need to be supported and encouraged to engage with the health service, and it's not always been a positive experience for them, but you want to make this time a good thing for them and feel safe and comfortable as much as you can.
That's great, Marion. Well done on it. And I think there's something about that starting the conversation thing of, you know, the idea of older people, you know, being invisible, older LGBT people. You know, not everyone is going to the discos, and not that anyone's going to the discos at the moment, but, you know, that idea of people think of people who are gay as young people. So I think that's one of the real strengths. People like Mary just talking about it and encouraging that kind of visibility. So we're going to hear now from Siobhan Ryan, who is one of the trainees from the LGBT Ireland Champions programme.
So my name is Siobhan Ryan, and I'm an advanced nurse practitioner in frailty and the older persons in South Tip General Hospital in Clonmel, and I was nominated as I am working in the older persons, and that was the reason I was nominated to become a champion. I suppose first of all I should say my initial reaction to being actually being asked to become a champion was that I absolutely knew nothing about LGBT, especially for the older persons that are identifying as LGBT. And secondly, also, how was I going to help, and what was I going to do? So by doing the LGBT champion course, wow, I really learned an awful lot. I learned the patients that are identifying as LGBT, that they were more likely to be not having come out and disclosed to anybody, that they were possibly more lonely, that their family relationships had broken down. And you know, I would meet an awful lot of older patients that may be in this situation, and sometimes we don't know why, and we try and help them in various different ways like that, promoting a loan. And sometimes it would be nice to be able to identify a little bit more with them and have more understanding. Also that they may have self-harmed, that they may have detrimental health practices than their heterosexual counterparts. For me, like, old age claims us all, and each person comes with a lived life that is worth talking about. And I'm there, and I'm in this privileged position that I have time to listen, and I can listen to people. And I also have a sense of responsibility to change our practice, to identify with the person that is identifying as LGBT, and also to educate my colleagues so that the person identifying as LGBT can feel safe, and perhaps safe enough to disclose or just talk openly about their fear of discrimination to us.
That's great. From listening to both Mary and Siobhan, that the participants on the programme have enjoyed it. It's opened their eyes, it's changed their practices. What kind of feedback are you getting, if you are getting, from the other beneficiaries, the older LGBT? Are you hearing anything back from people about how changes in behaviour are actually impacting on them?
We have certainly through around the country. The program's been going on since 2018, and we certainly have had older people who have been positively impacted from it. We've heard stories of people, psychotherapists working with clients who once they started displaying the poster, then they revealed their identity to them, and actually through that managed to reduce the amount of time they actually needed care. We also have an older person who, through just the formation of the network, because the way this operates is that it creates a network of LGBT aware people working in older people's services. We have an individual who entered the service in Dublin and was able to be put in contact with a person then in Kerry and in Cork, and through that was able to move through an LGBT inclusive system and that sort of wraparound care. So we've seen that. I would love to get a chance to actually speak to some of the older people who've had that difference made for them and hear directly about it. But I suppose just hearing back from our champions the difference that they're making and the impact it's having for them, I mean, that's very powerful.
Absolutely. And in the context of today's webinar, where we're looking in particular at health and well-being, there's no doubt that being able to go into a GP or into a nursing practice and feel welcomed, there's a poster, there's a pin, there's somebody who's done the Champions course, and I think even that as a sort of just a calming influence and a sense of I'm okay here, I'm accepted here, that must be wonderful for the beneficiaries. So, well done to you both, to Mary and to James and to Siobhan. It was really super to talk with you this afternoon, and we get a chance later on in the programme to have more conversations. Well done, thanks very much.
Thank you very much.
Great stuff. So with James's permission, I'm actually going to go straight into the panel discussion and go directly to Colette. Colette O'Regan works with James and in fact is one of the trainers on the Champions programme. Colette, you're very welcome. Great to see you. Colette, could I ask you, as a trainer on the LGBT Champions programme, what is the best way for those who are watching? You know, this goes out to many of the HSE staff up and down the country, those who might be interested in becoming part of the programme. What's the best way for them to get in touch with you to access the training that you're delivering?
Thanks, Grania, and hi, everybody. I think the best way for everybody, first of all, I hope that everybody sees this as something that's relevant to them, whether they're in a healthcare setting, a social care setting, or a community setting which interacts with older people. We're trying to create as many opportunities for older LGBT people to see a friendly, welcoming rainbow queue to reveal, as James says, their big secret. Because I suppose this program is really targeting those who've never had a chance in their lives to be truly who they are. They've never felt safe. And now at this late stage in life, so vulnerable, often additionally dependent and more likely to be in health and social care settings, we need them to feel safe and to enjoy this new Ireland, which is more welcoming. So the easiest way for people to get in touch with us is to go onto our website, lgbt.ie. You'll see our Champions Programme tab. You'll get straight in touch with James at lgbt.ie, or myself under the training tab.
Right.
And you'll also see a lot more information there generally about our community, and you'll also see our general other training offers to anybody who wants to be more inclusive.
That's great.
Thank you.
Thanks so much, Colette, and to James. So the rest of our panel, we're joined by people you've met earlier on this afternoon: Sarah McCormick, Martina Blake, Kate Cassidy, Maeve McKeown, Kate O'Connor, Nick Fenlon, Michelle Flood, and you've just met Colette there and James. So mindful, I suppose, of our panel, we have been getting questions in from people, and I've just gone to Colette with that particular follow-up question. I want to go back, if I could, to very briefly to Kate O'Connor from the Living Well programme. Kate, we heard earlier from Maeve about the Living Well projects, and I was struck by the fact that at least one facilitator on every programme has to be a person living with a long-term condition. Can you tell me very briefly about the importance of that type of patient involvement for the success of your programme?
Most definitely, yes. The fidelity of the programme is we cannot deliver a Living Well programme unless at least one of the two trained facilitators is living with a long-term health condition. And this has been really valued by participants because they feel a certain amount of empathy and understanding. But it's also very valued by our facilitators. And one quote that we've heard, that they feel no longer just a disease on legs, but they also know that having lived with a disease, they're able to share their learning, and that the disease is not just a burden, but actually something that gives them a skill set. Also, I suppose the voice of the person with long-term health condition is key to the project here in the Southeast. We have 5 people on our steering committee who are living with a long-term health condition, and we report to them every month, along with the voluntaries and with people from primary care, mental health, acute hospitals, GPs, practice nurses. They're side by side on our expert committee, telling us and feeding back to us about, are we going in the right direction? And that has really been important for communications, for quality assurance, and for really trying to keep things patient-centred.
Great, and so important for the general principle of patient involvement. Thanks for that, Kate. Another quick one for Nick. Nick, Katie Murphy writes in to say, are you including practice nurses in the education and the survey?
Absolutely. I think one time it was very much the College of General Practitioners, and that's the title, that's what it is, and it was education for general practitioners. Now, I mean, we're all aware of it's education for general practice, and everybody involved, including like practice managers, receptionists, and practice nurses. We've had a number of requests from practice nurses to participate on our webinars, and we've given them access on the night. Obviously, there's some education that is specific to GPs and GP work around prescribing and things like that. But again, we're absolutely open to practice nurses approaching us, and we give them temporary access to the education platform. On some occasions, if the education that is recorded is the work of a practice nurse, then we share it with the IPNA, the Irish Practice Nurse Association, and they host it on their website as well. Right. So again, if anybody out there, you know, has a practice nurse in mind and they want to approach us, tell them to contact me directly and we'll give them access. Yeah.
That's great, thank you. I have lots of other questions that have come in. We will get the questions to the panelists and get the answers back out to people, but we're just running out of time here. I want to thank all of our guests. Our next webinar is planned for Thursday, the 19th of November, again 3:30 to 5, and our theme then will be engaging communities. So put that date in your diary and do join us again to see how so many HSE frontline workers, Department of Health staff, in partnership with local community groups and health and service providers across Ireland, are making changes to improve health and care services for all of us as part of Sláintecare, delivering the right care in the right place at the right time. Meanwhile, I want to thank all the team here who helped to produce this session: Rosaline Harlan, Muriel Farrell, Lindsay Dre, Ingrid Doyle, Erica Kinsella, Suzanne Lynch, Andrew Hannigan and Tom Jukes. If you are involved in a project which is promoting integrated care, do get in touch with us by email, and you can watch this webinar back or recommend it to colleagues. It will be available on the Sláintecare website. So do send us your feedback, and questions we didn't get a chance to answer will be posted in the coming days. So from me, Gráinne Healy, stay safe, wash your hands and hold firm as Sláintecare continues to deliver on its promise as set out. So to close this afternoon, we are delighted to have Laura McGahey, Executive Director of Sláintecare, to say a few words.
Good afternoon, everyone, and thank you, Gráinne, and thank you all for tuning in today. It's been really interesting to hear of all of the progress that's happening, notwithstanding the challenges that COVID has brought us all. Health and well-being is a critical part of Sláintecare, and the focus on prevention, the focus on keeping people well in their own homes, empowering people, and ultimately keeping people out of hospitals is a critical part of what we're all about: the right care, the right place, and the right time. I'm really pleased that Budget 21 recognised this critical part of the Sláintecare programme by putting substantial additional funding into health and wellbeing, and in particular in having a focus on area-based disadvantaged health and wellbeing programmes. So look forward to exploring that all with you. I would like to thank you for especially your focus on getting good results from your projects, notwithstanding the challenges that COVID has brought about. And I think what you've demonstrated today is the ingenuity that you all have in actually making the projects happen. Even though a lot of it was planned face-to-face, you managed to pivot and make changes in that regard. And it's very important that we get the results through the PUBL process that's happening at the moment, so that we can establish which projects can be scaled or maintained into the future and into next year. So in conclusion, I would like to just congratulate everybody, and I suppose to maybe leave you with a thought that your work is more important now than ever, given the level 5 that we're all in, and the focus that has to be put on trying to keep people well, including ourselves, and the importance of mental and physical health and well-being. So thank you for everything you've been doing. Look forward to seeing you on November the 19th. Slán go fóill.
Well done.